Hello, welcome to the recording on rest and sleep. Rest and sleep are vital for life and health. A person's body needs both sleep and rest, as rest is a vital component of restorative sleep. Deficiencies in rest and/or sleep can have a negative impact on a person's mental, physiologic, and emotional health. Here are the learning objectives for this chapter. Please take a moment to review each one of these. If you can speak to these and apply them to your learning practice, then you have accomplished your learning for this chapter. Sleep is an important part of your daily routine. You spend about 1/3 of your time doing it. Quality sleep and getting enough of it at the right times is as essential to survival as food and water. Without sleep, you can't form or maintain the pathways in your brain that let you learn and create new memories, and it's harder to concentrate and respond quickly. Sleep is important to a number of brain functions, including how nerve cells, called neurons, communicate with each other. In fact, your brain and body stay remarkably active while you sleep. Recent findings suggest that sleep plays a housekeeping role that removes toxins in your brain that build up while you are awake. Rest is a decreased state of activity and involves your whole being, not just your body. With complete and regular rest, you can restore your health, enhance your performance, and achieve an amazing sense of well-being. Getting the proper amount of rest and sleep can boost memory, enhance productivity and concentration, increase alertness, improve mood, stimulate creativity and problem solving, decrease the risk of heart disease, strengthen the immune system, decrease stress. Sleep is a state of rest accompanied by altered consciousness and relative inactivity. Sleep is part of what is called the sleep-wake cycle. Wakefulness is a time of mental activity and energy expenditure. Sleep is a period of inactivity and restoration of mental and physical function. The reticular activating system is a complex bundle of nerves in the brain that's responsible for regulating wakefulness and sleep-wake transitions. It filters out unnecessary noise that can interfere with the processing of messages or slow the processing of messages during sleep. The RAS keeps the brain gear up for a higher level of activity so that you can arise in the morning. As the brain's attention center in which external stimuli is systematically organized into conscious thought. In order to get you up in the morning, the RAS responds to various triggers such as the sun, sounds, and other external stimuli. Sleep-wake homeostasis keeps track of your need for sleep. The homeostatic sleep drive reminds the body to sleep after a certain time and regulates sleep intensity. This sleep drive gets stronger every hour you are awake and causes you to sleep longer and more deeply after a period of sleep deprivation. Factors that influence your sleep-wake needs include medical conditions, medications, stress, sleep environment, and what you eat and drink. Perhaps the greatest influence is the exposure to light. Specialized cells in the retinas of your eyes process light and tell the brain whether it is day or night and can advance or delay our sleep-wake cycle. Exposure to light can make it difficult to fall asleep and return to sleep when awakened. Sleep is not uniform. Instead, over the course of the night, your total sleep is made up of several rounds of the sleep cycle, which is composed of 4 individual stages. In a typical night, a person goes through 4 to 6 sleep cycles. Not all sleep cycles are the same length, but on average, they last about 90 minutes each. Non-REM sleep is composed of 4 different stages. The higher the stage of non-REM sleep, the harder it is to wake a person up from their slumber. During REM sleep, brain activity picks up, nearing levels seen when you're awake. At the same time, the body experiences atonia, which is a temporary paralysis of the muscles, with 2 exceptions, the eyes and the muscles that control breathing, which is good because it would be bad to not breathe. Even though the eyes are closed, they can be seen moving quickly. Take a look in your book for characteristics of non-REM and REM sleep. Non-REM sleep is composed of 3 different stages. The higher the stage of non-REM sleep, the harder it is to wake a person up. In stage 1, which is also called N1, it's essentially when a person first falls asleep. The stage normally lasts just 1 to 7 minutes. During N1 sleep, the body is not fully relaxed, though the body and brain activity start to slow with periods of brief movements. There are light changes in brain activity associated with falling asleep in this stage. It is easy to wake someone up during this sleep stage, but if a person is not disturbed, they can move quickly into stage 2. As the night unfolds, an uninterrupted sleeper may not spend much more time in stage 1 as they move through further deep sleep cycles. In stage 2, or N2, the body enters a more subdued state, including a drop in temperature, relaxed muscles, and slowed breathing and heart rate. At the same time, brain waves show a new pattern and eye movement stops. On the whole, brain activity slows, but there are short bursts of activity. Stage 2 sleep can last from 10 to 25 minutes during the first sleep cycle, and each N2 stage can become longer during the night. Collectively, a person typically spends about half their sleep time in N2 sleep. Stage 3 sleep is also known as N3, or deep sleep, and it is harder to wake someone up if they are in this phase. Muscle tone, pulse, and breathing rate decrease in N3 sleep as the body relaxes even further. The brain activity during this period has an identifiable pattern of what are known as delta waves. For this reason, stage 3 may also be called delta sleep or slow wave sleep. Experts believe that this stage is critical to restorative sleep, allowing for bodily recovery and growth. It may also bolster the immune system and other key bodily processes. Even though brain activity is reduced, there is evidence that deep sleep contributes to insightful thinking. As the patient continues sleeping, these stages get shorter and more time gets spent in REM sleep instead. A single normal sleep cycle in a young adult. In the normal nocturnal pattern, the shaded cycle is repeated 4 or 5 times. Periods of REM sleep generally increase in duration. Periods of deep sleep, stage periods of, deep sleep progressively decrease as morning approaches. An average adult person needs between 8 and 9 hours of sleep per night. Older adults need between 6 and 7 hours per night. No rigid formula exists for the regular intervals and duration of sleep. It is important, however, that each person follow a pattern of rest that maintains one's own well-being. Also, no need to memorize this information, but instead have a bigger picture view. Despite individual variations, some generalities can be stated. On average, infants require 12 to 15 hours each day, toddlers 11 to 14, preschoolers 11 to 13, school-age children 6 to 13 require from 9 to 11 hours of sleep, and teenagers 8 to 10 hours. Again, no need to really know that. I would probably know the average adult versus the older adult, just because that's pretty much what we study. The term sleep deprivation refers to getting less than the needed amount of sleep, which for adults is at least 7 hours and more like 7 to 9 hours. However, being well rested is about more than just how many hours you sleep. As a result, the terms sleep deficiency and sleep insufficiency are more frequently used to describe factors that reduce the quality and or quantity of sleep and keep a person from waking up refreshed. For example, a person who sleeps for a total of 8 hours, but with many awakenings that fragment their sleep, may have insufficient sleep, even though their sleep duration technically meets the recommended amount. The primary signs of sleep deprivation include excessive daytime sleepiness and daytime impairments such as reduced concentration, slower thinking, and mood changes. Feeling extremely tired during the day is one of the hallmark symptoms of sleep deprivation. People with excessive daytime sleepiness may feel drowsy and have a hard time staying awake even when they need to. In some cases, this results in microsleeps in which a person dozes off for a few seconds. Insufficient sleep can directly affect how a person feels during their waking hours. Examples of these symptoms include slowed thinking, reduced attention span, worsened memory, poor or risky decision-making, lack of energy. Mood changes include feelings of stress, anxiety, or irritability. A person's symptoms can depend on the extent of their sleep deprivation and whether it is acute or chronic. Stimulants like caffeine can also mask the symptoms of sleep deprivation, so it's important to note how the patient feels on and off of these substances. Acute sleep deprivations raises the risk of unintentional errors and accidents. Drowsy driving, which involves slow reaction times and risk of microsleeps, can be life-threatening. Its effects can also lead to mood changes, personal relationship issues, mental health issues, diabetes, obesity, pain, immunodeficiency, hormone imbalances, and cardiovascular disease. Bet you didn't know all those things were affected just by not getting good sleep. Multiple factors can cause or contribute to sleep deprivation, including poor sleep hygiene, lifestyle choices, stress, medical conditions like chronic pain, work obligations, sleep disorders, and other medical conditions. Sleep deprivation may be driven by voluntary choices that reduce available sleep time. For example, a person who decides to stay up late to binge watch a TV series may experience acute sleep deprivation. An inconsistent sleep schedule may facilitate these decisions and make them feel less intentional in the moment. Work obligations are another common contributor to sleep deprivation, as is being a nursing school student. People who work multiple jobs or extended hours may not have enough time for sufficient sleep. Shift workers who have to work through the night may also find it hard to get the amount of sleep that they really need. Sleep deficiency may be caused by other sleep disorders or medical conditions. For example, sleep apnea, a breathing disorder that can induce dozens of nightly awakenings, may hinder both sleep duration and quality. Other medical and mental health concerns, such as pain or general anxiety disorder, can interfere with the quality and quantity of sleep. Also, many common chemicals affect both quality and quantity of sleep. These include caffeine, alcohol, nicotine, and antihistamines, as well as prescription medications including beta blockers, alpha blockers, and antidepressants. External factors such as what we eat and drink, the medications we take, and the environments in which we sleep can also greatly affect the quantity and quality of our sleep. In general, all of these factors tend to increase the number of awakenings and limit the depth of sleep. The stress of chronic illness can also cause insomnia and daytime drowsiness. Common conditions often associated with sleep problems include heartburn, GERD, diabetes. Insufficient sleep appears to affect the body's ability to regulate blood sugar, increasing the risk of metabolic conditions like diabetes. Coronary artery disease, epilepsy, cardiovascular disease like high blood pressure, coronary heart disease, heart attack, and stroke, musculoskeletal disorders, kidney disease, mental health problems, neurological disorders, respiratory problems, liver failure, encephalitis, end-stage renal disease, and thyroid disease. I feel like that's like everything. In addition, a number of prescription and over-the-counter medications used to treat these and other health problems can impair sleep quality and quantity. Here's some things that we can do. We can increase physical activity and make it a morning routine. Make sure not to work out 2 to 3 hours before bed. Activity and exercise increase fatigue and can promote relaxation, followed by sleep. It increases both REM and non-REM sleep, contributes to a more restful sleep. Plus, the exposure to light is good for the patient's circadian rhythm, a natural internal process that controls the sleep-wake cycle. Eat a healthy diet. The patient should be encouraged to eat plenty of fiber-rich vegetables, fruits, legumes, and whole grains, including nuts and fish, while minimizing processed meats, trans fats, refined carbs, and sugary drinks. Amino acid L-tryptophan and fiber promotes deep sleep, while large quantities of alcohol, saturated fat, and sugar limit REM and delta sleep. And caffeine blocks the ability of adenosine to cause drowsiness. Remember, a small protein snack combined with a healthy, complex carb before bed improves sleep. For example, lean cheese, milk, almonds, banana, yogurt. Simple carbs and saturated fats represent the danger zones for pre-sleep snacks. Both can reduce serotonin and can be difficult to digest. In practice, this means avoiding sweets and sugar, fast food, and caffeine, no dark chocolate, burgers, coffee, or soda. Alcohol can make the patient sleepy in the short term, but it can also cause disorganized sleep, so it is discouraged. Certain spicy foods are also hard to digest and can cause the patient to wake up throughout the night, so they should be avoided as well. Balance calories throughout the day. When the patient gets more calories late at night, sleep is less peaceful, as is drinking too many sugary, caffeinated, or alcoholic beverages before bed because they lead to more disruptions during the night. Find a relaxing ritual before bed, like meditation, yoga, or deep breathing. Go low tech. If you're seeking better sleep, try not to use cell phones and other devices late in the evening. Shining a bright light in your face before bedtime is counterproductive. No smoking 2 to 4 hours before bed. What psychological factors affect sleep? Stress, bereavement, unfamiliar sleep environment, jet lag, shift work, bed partner, or poor sleeping environment, like noise, temperature, light, or a poor sleeping surface, can all negatively affect sleep. How about sleeping with 2 big dogs and 2 cats? The cats walk on my head, and the dogs are constantly deciding it's time to get up in the middle of the night. That will affect it too. High levels of stress impair sleep by prolonging how long it takes to fall asleep and fragmenting sleep. Sleep loss triggers our body's stress response system, leading to an elevation in stress hormones, namely cortisol, which further disrupts sleep. It can also cause individuals to wake more frequently during the night. And there is now robust evidence similarly supporting that sleep is critical to not only our physical health, but also our mental health. Poor or insufficient sleep has been found to increase negative emotional responses to stressors and to decrease positive emotions. How do medications influence or impact sleep? Ingredients found in asthma inhaler medications like bronchodilators, such as albuterol, or common cold and cough medicines and decongestants, weight loss medications, ginseng, high doses of vitamin B, can cause anxiety, jitteriness, or restlessness that can interfere with sleep. Prescription steroids and stimulant medications can make patients feel energized and stimulate wakefulness, so should be taken in the morning, unless instructed otherwise by a provider. Finally, chronic and long-term sedative or hypnotic use to induce sleep may cause tolerance to the sedative effect and can contribute to chronic insomnia. Benzodiazepines, antidepressants, beta blockers, anti-Parkinsonian drugs, those all cause excessive sleepiness. Do not give diuretics within 6 hours of a person's bedtime. That's good to remember. I'm looking for other things. I feel like that's about it. They're all causes of insomnia are listed on the page. You can read them. Listed here are some common sleep disorders we will discuss. Some of these more closely in the following slides. Insomnia is a common sleep disorder characterized by difficulty falling asleep, intermittent sleep, or difficulty maintaining sleep, despite adequate opportunity and circumstances to sleep. Patients who have it may have trouble falling asleep, staying asleep, or both. As a result, they may get too little sleep or have poor quality sleep and may not feel refreshed when they wake up. Insomnia can be acute or chronic. Acute insomnia is common. Common causes include stress at work, family pressures, or a traumatic event. It usually lasts for days or weeks. Chronic insomnia lasts for a month or longer. Most cases of chronic insomnia are secondary and a symptom or side effect of some other problem, such as certain medical conditions, medications, and other sleep disorders. Substances like caffeine, tobacco, and alcohol can also be a cause, as we've already discussed in this PowerPoint. People with depression are more likely to experience insomnia. Obstructive sleep apnea is the most common sleep-related breathing disorder. People with obstructive sleep apnea repeatedly stop and start breathing while they are sleeping. There are several types of sleep apnea. Obstructive sleep apnea occurs when the throat muscles relax and block the airway. This happens off and on many times during sleep. A sign of obstructive sleep apnea is snoring. Obstructive sleep apnea causes breathing to repeatedly stop and start during sleep. There are several types of sleep apnea, but the most common is obstructive sleep apnea. I feel like I've already said all this. A noticeable sign is snoring. Treatments for obstructive sleep apnea are available. One treatment involves using a device that uses positive airway pressure, or PEEP, to keep the airway open. It's called a CPAP. Oh, I guess it's PAP. Positive airway pressure, CPAP. A continuous positive airway pressure machine keeps the airway open while the patient sleeps. Another option is a mouthpiece to thrust the lower jaw forward during sleep, called a mandibular advancement device. In some cases, surgery may be an option too. Symptoms of obstructive sleep apnea include daytime sleepiness, loud snoring, observed episodes of stopping breathing during sleep, waking during the night and gasping or choking, awakening in the morning with a dry mouth or a sore throat, morning headaches, trouble focusing during the day, mood changes such as depression or being easily upset, high blood pressure. Complications can include cardiovascular problems. Sudden drops in blood oxygen levels that occur during obstructive sleep apnea increase blood pressure and strain the cardiovascular system. Daytime fatigue, high blood pressure or heart problems, type 2 diabetes, metabolic syndrome, liver damage, and eventually failure. Sleep-deprived partners, daytime fatigue and sleepiness. The repeated awakenings associated with obstructive sleep apnea make normal restorative sleep impossible. The worse the obstructive sleep apnea, the greater the risk of coronary artery disease, heart attack, heart failure, and stroke. Obstructive sleep apnea also increases the risk of heart rhythm problems known as arrhythmias. Arrhythmias can lower blood pressure. If you have moderate to severe sleep apnea, you might benefit from using a machine that delivers air pressure through a mask while you sleep. With CPAP, the air pressure is somewhat greater than that of the surrounding air and is just enough to keep your upper air passages open, preventing apnea and snoring. CPAP is the most common and reliable method of treating sleep apnea. If using a CPAP machine continues to be a problem for you, you might be able to put a different type of airway pressure device that automatically adjusts the pressure while you're sleeping. Units that supply bi-level positive airway pressure are also available. These provide more pressure when you inhale and less when you exhale. There's also the oral appliances. Looking at some other stuff. You can use supplemental oxygen, adaptive servo ventilation. Good enough. Let's go to the next slide. Let's see. These disorders are characterized by excessive daytime sleepiness that is not attributable to other sleep disorders, specifically those that relate in disturbed sleep. Idiopathic hypersomnia causes excessive daytime sleepiness despite adequate or more typically long sleep amounts, more than 9 or 10 hours in a 24-hour period. People with idiopathic hypersomnia often struggle to wake despite setting multiple alarms and have difficulty rising from bed. They may start the day feeling extremely groggy and can experience significantly reduced focus and concentration during waking hours. Narcolepsy is a chronic sleep disorder characterized by overwhelming daytime drowsiness and sudden attacks of sleep. People with narcolepsy often find it difficult to stay awake for long periods of time, regardless of circumstances. Narcolepsy can cause serious disruptions in your daily routine. Sometimes narcolepsy can be accompanied by a sudden loss of muscle tone or cataplexy, which can be triggered by strong emotion. Narcolepsy that occurs with cataplexy is called type 1 narcolepsy. Narcolepsy that occurs without cataplexy is known as type 2 narcolepsy. Narcolepsy is a chronic condition for which there's no cure. However, medications and lifestyle changes can help you manage the symptoms. Support from others like family, friends, employees, and teachers can help you cope with narcolepsy. Circadian rhythm disorders, endogenous sleep-wake rhythms, or your body clock, and the external light-darkness cycle become misaligned or desynchronized. The cause may be internal, such as delayed or advanced sleep phase syndrome, or external, such as jet lag or shift work. Circadian rhythm sleep disorders may occur in patients with Alzheimer's disease or Parkinson's disease, and in patients who have had head trauma or encephalitis. If the cause is external, then other circadian body rhythms, including temperature and hormone secretion, can become out of sync with the light-darkness cycle and with one another. In addition to insomnia and excessive sleepiness, these alterations may cause nausea, malaise, irritability, and depression. Risk of cardiovascular and metabolic disorders may also be increased. Parasomnias are a group of sleep disorders that involve unwanted events or experiences that occur while you are falling asleep, sleeping, or waking. Parasomnias may include abnormal movements, behaviors, emotions, perceptions, or dreams. Although the behaviors may be complex and appear purposeful to others, you remain asleep during the event and often have no memory that it occurred. If you have a parasomnia, you may find it hard to sleep through the night. Examples of parasomnias include bruxism, which is grinding the teeth. And if we note that our patients are doing that, we refer them to their dentist after discharge. Restless leg syndrome is a condition that causes an uncontrollable urge to move your legs, usually because of an uncomfortable sensation. It typically happens in the evening or nighttime hours when patients are sitting or lying down. Moving eases the unpleasant feeling temporarily. Restless leg syndrome, also known as Willis-Ekbom's disease, can begin at any age and generally worsens as the patient ages. It can disrupt sleep, which interferes with daily activities. Simple self-care steps and lifestyle changes may help relieve symptoms. Medications also help many people with restless leg syndrome. Common accompanying characteristics of restless leg syndrome include sensations that begin after rest. It usually begins when the patient's been laying down or sitting for an extended time, such as in the car, airplane, or movie theater. And they experience relief with movement, like stretching or jiggling their legs, pacing or walking. And it gets worse in the evening and mainly at night. At night, the legs tend to twitch. Periodic limb movement of sleep, which causes legs to twitch and kick, possibly throughout the night while the patient sleeps. There are two main treatment techniques to manage dysomnia, psychological and pharmacological. These may be used alone, but are often used in combination to control symptoms of the disorder. Psychological treatment techniques are the preferred first-line choice of treatment for primary sleep disorders, including discussion about sleep hygiene and implementing techniques to improve sleep. Cognitive behavioral therapy is a common technique used to improve sleep in dysomnia. Cognitive behavioral therapy 1 focuses on restructuring the thoughts, feelings, and behaviors that are contributing to insomnia. These techniques involve stimulus control, sleep restriction, and relaxation training. Most individuals who try cognitive behavioral therapy type 1 experience improvements to their insomnia and better quality of sleep. The 5 key components of cognitive behavioral therapy are sleep consolidation, which is a method of trying to compress the total time in bed to match the total amount of sleep needed. The patient goes to bed at 11, but does not fall asleep until 1 a.m. Then stimulus control, set of instructions addresses conditioned arousal. They are designed to strengthen the bed as a cue for sleep and weaken it as a cue for wakefulness. Only use your bed for sex and sleep. Cognitive restructuring, changing the negative thoughts and beliefs that insomniac has developed about sleep because of prior negative experiences. This is terrible. Sleep hygiene refers to healthy habits, behaviors, and environmental factors that can be adjusted to help have a good night's sleep. And relaxation techniques. Pharmacological methods are most appropriate in acute circumstances, such as the presentation of sleep disorders in a time of grief. This may include the use of medication, such as melatonin, to alter the sleep cycle, or other drugs to aid sleep at nighttime or increase alertness during the day. Bright light or dark therapy may also offer a benefit to adjust the body clock for individuals with circadian rhythm sleep disorders. Medications include sedatives like benzodiazepines and hypnotics. Ambien is what we usually call it, but zolpidem is, I think, the other name of it. At higher doses, sedatives usually cause sleep. Drugs used mainly to cause sleep are called hypnotics. The difference between sedatives and hypnotics, then, is usually the amount of the dose. Lower doses have a calming effect and higher doses cause sleep. Healthcare providers in all settings should incorporate questions about sleep into routine health assessments. Interview questions help identify the patient's sleep-wakefulness patterns, the effect of these patterns on everyday functioning, the presence of factors that may be affecting the patient's sleep, the patient's use of sleep aids, and the presence of sleep disturbances and contributing factors. When a sleep disturbance is noted, ask about the following when obtaining the history: the nature of the problem, the cause of the problem, the related signs and symptoms, when the problem began and how often it occurs, how the problem affects everyday living, the severity of the problem, and whether it can be treated independently by nurses or needs to be referred to another health care professional, how the patient is coping with the problem, and the success of any treatments attempted. Sleep deprivation is a condition that occurs when a patient doesn't get enough sleep. It is the #1 cause of sleep disorders in healthcare institutions and will eventually cause delirium, irritability, impaired mental function, and personality changes. Treat by improving sleep time, minimize disruptions, no napping during the day, and implementing the following basic tips. Stick to a sleep schedule. Keep your bedtime and wake time consistent from day to day, including on the weekends. Stay active. Avoid or limit naps. Avoid or limit caffeine and alcohol, and don't use nicotine. Don't put up with pain, but instead medicate for it. Avoid large meals and beverages before bed. The Epworth Sleepiness Scale, or ESS, is an 8-item questionnaire that assesses subjective daytime sleepiness. The ESS assesses the likelihood of dozing in different common situations, like a 4-point Likert response format, which is scored from 0 to 3, with higher scores indicating more severe sleepiness. Item responses are summed to obtain a total scores range from 0 to 24, with a score greater than 10 indicating excessive daytime sleepiness. The ESS is routinely used in research and clinical practice to evaluate the presence and severity of excessive daytime sleepiness in older adults. Then we have the Pittsburgh Sleep Quality Study. You guys can read up on these, I feel like. Let's see what's different about this. It has 19 items to measure 7 domains of sleep quality. Subjective sleep quality, sleep latency, sleep duration, habitual sleep efficiency, on and on. 5 additional items are included in the questionnaire that are completed by a bed partner, but are not included in the calculation of the global sleep quality score. Let's see. A PSQI score greater than 5 indicates a poor sleeper. Physical assessment findings. Have your patients keep a sleep diary, and it'll help you track their sleep. You can see habits and trends that are keeping people awake and preventing them from sleep, and make some recommendations on how they can improve. Listed on this slide are some of the information that the patient would record in a sleep diary. Pause the video and read through them and make note cards. The findings in the physical assessment may either confirm that the patient is getting sufficient rest to provide energy for the day's activities, or validate the existence of a sleep disturbance that is decreasing the quality or quantity of sleep. Key findings include energy level, presence of physical weakness, fatigue, lethargy, or decreased energy, facial characteristics, narrowing or glazing of eyes, swelling of eyelids, decreased animation, or behavioral characteristics like yawning, rubbing the eyes, slow speech, slumped posture. Physical data suggestive of potential sleep problems can be obesity, enlarged neck, and a deviated nasal septum may also be noted. Listed on this slide are some nursing diagnoses for those suffering from sleep disorders. Pause the video and read through them, please. Strong sleep hygiene means having both a bedroom environment and daily routines that promote consistent, uninterrupted sleep. Keeping a stable sleep schedule, making your bedroom comfortable and free of disruptions, following a relaxing pre-bed routine, and building healthy habits during the day can all contribute to ideal sleep hygiene. Obtaining healthy sleep is important for both physical and mental health, improving productivity and overall quality of life. Everyone, from children to older adults, can benefit from better sleep, and sleep hygiene can play a key part in achieving that goal. Research has demonstrated that forming good habits is a central part of health. Crafting sustainable and beneficial routines make healthy behaviors feel almost automatic, creating an ongoing process of positive reinforcement. On the flip side, bad habits can become ingrained, even as they cause negative consequences. Good sleep hygiene is all about putting yourself in the best position to sleep well each and every night. Good habits include a specific sleep schedule, following a nightly routine, cultivating healthy daily habits, optimizing bedroom environment such as a comfortable pillow and mattress, set the room at a comfortable temperature, and block out light and noise. Having a set schedule normalizes sleep as an essential part of your day and gets your brain and body accustomed to getting the full amount of sleep that you need. Having a fixed wake-up time, prioritize sleep, make gradual adjustments, and don't overdo it with naps. Everyone's routines and environments are different, and therefore sleep hygiene should cater to the individual. Gotta pause. My phone's ringing. I kind of forgot where I was because I had to answer my phone. I think that was pretty much it. And I think there's your nursing interventions. I would know these. I mean, anything that has anything to do with your nursing interventions or your plan of care, know those. I feel like a lot of them also are very much just, if you have critical thinking skills, you'll be able to come up with these on your own. You want to bundle your care. You want to give them an appropriate snack before bed. use your medications to help them sleep if you need to. And then teach them about, find out what they do that prevents them from sleeping and help them to change those habits. I think that'll do. Let's finish up this chapter.